future meetings beginning in March will be in person with a WebEx connection. Lastly, in terms of introductions to the board and to those listening in, an adviso to be sure they and their families seek full vaccination with children up and coming. Louisvillians have done a good job in trying to eradicate the pandemic, and we certainly, on behalf of the board, ask the community to take this one last pandemic-ending action of full vaccination. As noted in your pre-board read, zip codes with the lowest rate, those fully vaccinated under 50%, include the following: 40203, 08, 10, 11, 12, 14, 15, 16, 19, 40229, 40258, where I think we have board members, and 40272. For board members, also a reminder that all zips were in your and vaccination percentages were in your board materials. I want to take this opportunity to give a special shout out to the Kentucky Nurses Association for their incredible work in partnership with Metro government in helping the city and the department administer vaccines in our most vulnerable areas. Our first order of business is the approval of the October minutes. Are there any comments on those materials, on the minutes? The chair will entertain a motion to approve the October meeting minutes. Margaret? Or Ms. Handmaker?
Yes, so moved.
Second?
Second.
Thank you. All in favor, say aye.
Aye.
Opposed? Abstentions? The minutes from October are approved. And now on to perspectives. Coming at what is an opportune global moment given the global conference, this morning's perspective session focuses on Louisville's brownfields and renewable energy and its human impact on residents. I've asked Dr. Moyer to introduce our presenter, Dr. Allison Smith, Assistant Director of the Office of Advanced Planning and Sustainability at Develop Louisville. Following her comments, the floor will be open for questions. Dr. Moyer, I yield the platform to you, wherever you are on the screen.
Thanks, Heidi. So I am pleased to welcome Dr. Allison Smith. She has a PhD in biology from the University of Louisville and is currently the Assistant Director of the Office of Advanced Planning and Sustainability here at Louisville Metro Government. She's leading our city sustainability and climate change efforts, manages the Brownfields program, and advises city agencies on effective community engagement. She's also a part-time lecturer in the biology department at the University of Louisville and has research interests of environmental justice and inclusive community engagement. So we invited her here today because after our lively discussion with our Metro Council members, Brownfields kept coming up as a possibility on how to improve health in our city. And so just wanted you all to hear what the city is doing right now, as well as climate change, because we know that is very important. So Allison, the floor is yours, and I apologize. I still don't see Amanda on, so I am not sure how to get you to share your screen. But if you want to talk through anything, I can email everything out to the board afterwards.
Sure, that's no problem. So thank you so much for the invitation to speak here today. We really appreciate the opportunity to introduce you to the work that we're doing in the Office of Advanced Planning and Sustainability. We know that a lot of our work affects public health, and so we're glad to be able to share some of that work with you today. Just to give you an introduction to our office, we cover a lot in our office. So we do neighborhood planning, multimodal initiatives, in addition to sustainability, public art, and brownfields. We feel that sustainability, now that it is housed with advanced planning, there's been a lot of benefits to that. We're able to consider sustainability in all of our planning initiatives, and it touches a lot more areas now that it's housed in advanced planning. Our sustainability team includes myself, my director, Mike King. Joining me also today is our sustainability coordinator, Julie Donna, our sustainability specialist, Sameda Rao. Not with us today is Zach Tyler. Zach is a part of our sustainability team. He is our energy manager. However, he is housed in fleet and facilities, but we still consider him an integral part of our team. To start off with, let's talk a little about brownfields. And I'm not sure exactly what level of knowledge this board has with brownfields, so I'm going to give you a quick overview and then an example of how a brownfields redevelopment takes place and then the programs that the city has to offer. A brownfield is any property that hasn't been redeveloped, sits vacant because there is contamination or even the perception of contamination. So think old dry cleaning sites, old gas stations, mechanic shops, old factories or industries where they used to use a lot of chemicals. Any of those could be considered a brownfield under the EPA definition and also our state definition. Common contaminants that we see in both the soil and the groundwater at brownfield sites. From dry cleaning, there are a lot of what we call VOCs, volatile organic compounds, as well as solvents that were used in dry cleaning. We see metals, acids, ammonia, heavy metals. These occur in lots of different areas, whether it's paper manufacturing, rail yards, landfills, gas stations. So we have a good idea of what the most common contaminants are. We know that there are potential health effects for many of these, ranging from damage to the nerves, organs, even cancer, issues with breathing, eye irritation, disruption to your immune system, all can be the effects of exposure to these different contaminants. Now, I will say that with brownfield, because the contamination is typically in the soil or the groundwater, it does require direct exposure to those in order to be affected by them. So, for example, if you were to grow vegetables in contaminated soil, or kids play in the dirt and may ingest some, or if we were to expose the groundwater, those are the exposure routes on brownfields. While there is not a significant direct exposure risk from brownfields, they are a part of the cumulative risk that we see, particularly in West and South Louisville, where we have more industry, we have rubber town, we have a lot of abandoned sites that are considered brownfields. So while your risk from the brownfield itself may be relatively low, it's a part of this cumulative risk of other things that add up within the area. And as you can see, this is the cancer risk based on exposure for West and South Louisville. So we do see elevated cancer rates. And again, this is part of a larger exposure of cumulative effects, and those things all add up. So I want to talk about one particular brownfield. This was a privately owned site. It was called Blackleaf Chemical, and it's on Dixie Highway. This site actually came to our attention when we were doing an assessment, a brownfields assessment plan for the 18th Street corridor. And this site was raised by residents who had concerns about the activities that used to take place there and whether or not those who lived adjacent to it were safe. So at this site, they actually manufactured pesticides. So there's actually DDT, benzene, dieldrin, as well as some polycyclic aromatic hydrocarbons or PAHs, as well as some heavy metals like lead and arsenic in the soil. Now, and this site had been abandoned for many years. It had transferred into new owners a couple of times. But the real concern was that it was relatively unmanaged. So it was sitting vacant, but you had a lot of people who were trespassing into buildings, who were potentially exposed to the contaminants there. But also the way the ground was sloped is during rain events, soil from the contaminated site potentially washed into adjacent yards, so residential yards that you can see highlighted here. So these houses all back up and are across an alley from the Blackleaf site. That's 18th Street on the far left. And then these are the cross streets. So these houses were directly adjacent to the site. And residents were concerned that there had been runoff from the site into their yards. And of course, some of these families, have kids that play in the backyard, that may grow vegetables there. And so there was some real concern. At this point, the state stepped in. So the state environmental protection in their waste management is housed their brownfields program. The state was able to step in with some emergency funds to address that. So they did some testing in the backyards. They did find some contamination. So what you see are the houses highlighted here. The state actually came in, excavated their yards, and brought in fresh soil. They replaced any trees or bushes that had been there and tried to put it back as close as they could to that. In addition, they put up control measures around the site. So, for example, silt fencing. So if you can have something that the water runs through, the contaminants that are attached to those dirt particles can get captured, and what leaves is just water. So they were able to provide fresh backyards for people and then ensure that that contamination wouldn't continue. Again, this was handled at the state level. It was a pretty big undertaking. So the current status is, again, it is privately owned. It was actually foreclosed on by the bank that owned it due to non-payment. The site control measures have been maintained for the last few years. And the responsible parties were the ones who performed the cleanup. So in this case, the companies that are involved with Blackleaf are still in existence today, and the state was able to work with them to ensure that they cleaned up the contamination that their companies were responsible for. So that included the demolition of all the buildings and removal of that. And like most brownfields, the contamination was not ubiquitous across the site. Usually you have hot spots where there's really high levels of contamination, and you may have other spots where it's lower or there may be none. So the soil was removed from those hot spots, the worst sites of contamination, and then taken off site. Now, it's interesting because this site, while it is adjacent to residential, is actually zoned industrial, which is why they were allowed to operate there. So because of its current zoning, the state could only require a cleanup to commercial industrial standards. That is a little bit lower standard than you would have for residential. And that makes sense if you think about those exposure pathways. If it's residential, you have people with a backyard, you have, again, long-term exposure. Whereas if it's a commercial or industrial site, you have workers there for 8 to 12 hours. They're not necessarily getting direct exposure to those contaminants. So those are two slightly different standards depending on the end use. So the state required cleanup to commercial industrial, and that was done by the responsible parties. And now there is a proposed development there of a 434,000 square foot office and warehouse building. This is a great reuse of a brownfield site. For one, that building and any parking will act as a cap. So if there is any residual contamination, there will be no way to be exposed to it. It'll be capped and maintained on site without any way for people to be exposed. It is low use, so you don't have more chemicals being brought in. It's not industrial. And actually, when we did engagement with the surrounding neighbors, one of the things they suggested seeing there, in addition to lots of ideas, was logistics, warehouse, something that would provide some jobs, but not add more contamination. So Blackleaf, this took over 10 years for all of this to transpire. And I just want to point out how complicated it can get when you have different owners, when you have responsible parties that may be involved, and often the state are the ones who have to handle that remediation and oversight. So in many of our brownfields, if you want to redevelop them, you work with the state on that redevelopment plan to make sure that public health is protected. So that's just one example of a brownfield and kind of the process that it goes through to get redeveloped. Now I have some tools to help with not only the few brownfields that we own, but also other privately owned brownfields. So I manage a $2.9 million brownfields revolving loan fund. So this is funded by the EPA, and it provides very favorable term loans for people who want to do remediation of a brownfield. So often if someone has plans for a site, they can get everything financed, but very few banks will finance brownfields remediation. They consider it risky. You don't know what you're going to find once you dig, and historically they have not jumped up to finance that. So that's where I'm able to step in with the revolving loan fund and say, look, you've got the rest of your development covered. Let me provide you this low interest loan that will cover the remediation costs, and that's able to keep that project moving. In addition, I can do sub-grants out of that revolving loan fund to nonprofits. So for example, pictured here is the Norton Healthcare Sports and Learning Center, the project of the Urban League. We were able to do a $350,000 sub-grant to cover the cost of their remediation for that site. So we're able to do that as well as provide loans for remediation. In addition to the revolving loan fund, we also have a $350,000 assessment grant for the 30th Street corridor. Now this is community-wide. It can be used anywhere in the community, but our focus is on the 30th Street corridor, where we know that there are a large number of brownfields, mainly because there's a railroad there, and so we often have industries that historically have lined that railroad. So we knew that there would be a lot of good candidates there. It would also support the other efforts that are going on in the Russell neighborhood. So far, we've done about 12 assessments for people. We're able to do everything with this grant short of putting a shovel in the ground. So any environmental assessment, redevelopment planning, cost estimates, any of those reports or assessments we're able to do to move that project a little bit closer to completion. And so far, we've done assessments for proposed developments such as affordable housing, mixed-use development, and even an urban agriculture business. So we've had a lot of success with the program so far. We feel that we are moving these forward and are able to have the private development that really is what turns these sites around. So we have a successful program on Brownfields, and I'm happy I do have more to talk about on climate change, but I just want to pause for a moment and see if there are any questions so far about the Brownfields.
Dr. Smith, it's Heidi. You might mention when we talked, there are 4, I think, so if you would just name those and over time as well.
Of course. So currently we own, you may be familiar with, thank you. You may be familiar with the Urban Government Center site. There is some residual contamination there, and we are working with a private developer to redevelop that site. So in that case, they would be eligible for funds from the revolving loan fund. The Rhodia site, which is at 11th and Hill Street, it's a former plastics and veneer manufacturing site. It's right across from Parkway Place, which is a public housing development. That site we're also negotiating with the developer on, and we'll work to see what help we can provide from our Brownfields program. The 2 others, or I guess one other that I'll mention is there is a former landfill on Gibson Lane that is currently controlled by the city. It's one that we own, and we're taking a look now to see what offer that for any use at this point. So we're looking to see what are our options for cleanup and how can we address that site, because we have had interest in it before, asking it, if it could be used for redevelopment. So those are the 3 big ones that we currently own that we're working on getting so 2 of the 3 actually have redevelopment plans, are moving forward towards remediation and redevelopment, and then we're starting that process with the Gibson Lane landfill as well.
Thank you.
Sure.
Renewable energy.
Right. Thank you so much for letting me slip this in. Where I think that we have the most concerns over public health in our department is around climate change. This is a graph that was done as a part of our climate adaptation plan. And this shows the 3 possible scenarios going forward from our historical to mid-century to late century, depending on what climate action we take. If we go business as usual, we change nothing, we continue emitting greenhouse gases, we will be in the red, which will mean by late century an increase in 7 to 12 degrees Fahrenheit. If we take action, we're able to keep that down to potentially 5 to 8 degrees average and a higher average temperature here in Louisville. So we do have time to significantly impact how much climate change and how much warming we will see here in the city. What we can expect to see based on current trends, so even if we do take action, we will still see climate change effects. We'll see warmer average temperatures, we'll see 14-degree hotter summer days, 42 more days per year over 100 degrees Fahrenheit, increased drought stress, and additional ground level ozone. So I don't need to tell this board the health effects we can expect to see that. In addition to things like heat stress and heat stroke, on those hottest days, we also see an increase in, for example, heart attacks. So lots of people with pre-existing conditions are impacted as we see these very hot days occur more and more frequently. We have taken action here at the city to address climate change, both through mitigation and adaptation. So we are part of what's called the Global Covenant of Mayors. In 2016, Mayor Fisher signed onto this. This is a group of cities who have declared, regardless of what happens at the federal level, we will work to stay within the 1.5 degrees warming Celsius that was established at the Paris Climate Accords. So we have been working locally to reduce our impact on climate change. So that means looking at how we adapt our city and prepare it to be resilient to the changes that we know will come. And also, how do we take action to mitigate, to reduce those effects, to reduce our greenhouse gas emissions. So we have both a climate adaptation plan and a greenhouse gas emission reduction plan that we are actively implementing to prepare our city and try to address the effects of greenhouse gas emissions. In September of 2019, there was a student-led climate strike. Mayor Fisher was invited to speak there, and at that time, he declared climate change an emergency. He declared a climate emergency, and that we needed to respond to climate change as we would a 911 call to fire, police, or EMS. Following that, in February of 2020, we were thrilled to see that Metro Council passed a 100% renewable energy resolution. So this has three components. The first is the one that we are working on most actively. That is 100% clean electricity for Louisville Metro government operations by 2030. So our electricity that we use in our facilities. So we are currently working with the National Renewable Energy Lab to see how we're going to achieve that. The second goal was 100% clean energy for Louisville Metro government operations by 2035. So this would include things like the way buildings are heated and cooled, as well as our fleet. So electrifying our fleet to not use any more fossil fuels for fuel. And then the third goal that they set was 100% clean energy community-wide by 2040. Now that is an incredibly ambitious goal, but I will say it is in line with what we have seen from the International Intergovernmental Panel on Climate Change from the UN. Those are the steps we need to take in order to mitigate the worst effects of climate change. So these goals are in line with what we need to see globally. We're approaching this renewable energy from two sides. I know everybody hears renewable energy goals and they think, oh, let's build solar, let's harness wind energy. That is actually only half of it. The other half is reducing our electricity demand. So the less energy that we use, either as a government or as a city, that is less renewable energy that we need to acquire. So as I mentioned, Zach Tyler, we consider him one of our own on sustainability. He is our energy manager, and he has made amazing strides in reducing our energy demand to this point through things such as building setbacks, controlling when the heat and cooling is on, making sure that vacant buildings aren't using too much energy. All of these things that not only reduce our energy use and the number of kilowatt hours we require, it also saves us a tremendous amount of money. So far, Zach has saved several $100,000s in energy bills, which we are now working to see how we can reinvest into things that will cost money, but will also continue to save us money, that will have a return on investment. So thinking about upgrading very old HVAC equipment, building insulation and envelope, things that will continue to reduce our electricity demand. So while he's working on that side of it to get our demand as low as possible, I'm working on the supply side. So the National Renewable Energy Lab is our...
Excuse me,
Sure.
Can you wrap it up?
Yes, of course. We
Okay.
have 4 different options to be able to get to 100% renewable for Metro government. They're going to help us evaluate LG&E's Green Tariff Program, where LG&E would build solar on our behalf. Look at what's called a virtual power purchase agreement, where we invest in renewable energy somewhere else. But also, what would it look like to municipalize our energy for the city? So actually the city owning and being able to control the energy that we create or that we buy off the grid. So these are what we'll be evaluating. And I bring this to your attention because we've already seen major organizations take action on this. The New England Journal of Medicine called for emergency action to limit global temperature increases. Climate change has been declared a health emergency. So at this point, LG&E and KU has currently released their integrated resource plan, and this describes how they're going to generate energy for the next 10 to 15 years. It is open for public comment and for intervention. So anyone who has concerns about the public health effects of burning coal and natural gas would be able to make a public comment that would go on the record as to how we think that those energy resources should be used going forward. So I will leave that with this group, that is an opportunity to intervene, to offer public comment about the public health effects that we see from burning coal and natural gas. I'll wrap it up there. I'm happy to come back anytime and talk about other initiatives that we have. And thank you again for the opportunity to speak today.
Dr. Smith, thank you. To say that you covered substantial ground would be an understatement and a horrible pun, not intended. But clearly the issue of the day, literally globally, and we have some strides that we can make in this community. I'm going to open the floor for questions from the board, and I'll save mine to allow for input from the board. Board?
So I have a related question. One of the simpler, low-tech interventions is improving tree canopy in Louisville, which has been tremendously under attack for decades. And 18 months ago, Metro Council made a small move, at least, in that direction. I'm wondering if there is data about the impact of the changes in April of 2020 and what the next steps would be.
Thank you for that question. And my colleague Julie Donna said, "Are you sure you don't want to mention tree canopy?" And I was like, "Oh, I'm already pushed for time." But I'm so glad you asked about this. Yes, tree canopy and our urban heat island effect are running tangential to our climate change issue. So the fact that our urban downtown core is up to 10 degrees hotter than outlying areas is due in large part to the lack of tree canopy. So I will say that we have been making efforts towards addressing that. We have recently hired someone for our Division of Community Forestry who is responsible for metro trees, so on public property as well as street trees. Brightside has a new director. They're responsible for community tree plantings, and they have done those extensively. And of course, we work really closely with our partners, Louisville Grows, Trees Louisville, and other organizations that are doing tree plantings. So inventorying how many trees we are planting, what our tree canopy is currently, how we maintain those trees is a huge project that we're currently working on through our sustainability work group. This is an interagency group that spans Metro that's addressing very specific sustainability issues. So we have a lot of ways to go, right? We lose trees due to age, disease, development, lack of maintenance. So having the funding in place to not only plant trees, but maintain them is really key to maintaining that urban tree canopy. So that is a focus that we are ramping up. And I believe that that will help to mitigate some of those climate change effects, not only with heat, but also stormwater runoff, our combined sewer overflow, and air quality.
Thank you. Next question from the board. All right, here we go. I assume one quick and, well, they're both quick with a net. The first is a bit tactical. Assume that this is an assumption of mine that as it relates to city department buildings and where everyone's housed, that as you go through and look for ways to reduce energy, et cetera, and emissions, et cetera, that you will have a ledger, so to speak, for each building to say this no longer emits this, et cetera, et cetera. So there'll be an inventory of each building.
Correct. So we use a program called Energy Cap. That gets our energy bills directly from LG&E, so we no longer have paper billing. That way we can see how much energy is used specifically on each account by each building. We're able to, and what we're working on now is importing a baseline for 2019. That'll be the year that we compare to. Obviously 2020 was radically different, but going forward, we can compare any changes that Zach makes in our energy use. We will compare that to our usage in 2019. So we can track how much less energy we have used, as well as how much we have saved, so that we can reinvest that in further energy efficiency programs. We have a web page called 100% Lou. Julie or Sumeda, if you could put that in the chat for me. We are going to host an actual live energy dashboard for Metro government's energy use on that web page that covers all of our climate change work. So the public, this board, anyone will be able to see the progress that we're making in decreasing energy use, as well as the resulting greenhouse gas emission reductions.
And finally, you mentioned input to the statewide plan, the LG&E KU plan, as something that the board or board members can do. Appreciate that. Are there any specific policies that you're pushing with Metro Council or others that would be helpful? And I would say, as a takeaway, if you could provide those to us, we'll take a look at them for consideration, and we're very good at making statements.
I will say that Metro Council has been a wonderful partner to work with. They are the ones who established those goals. They have been incredibly supportive. They have invited Zach back repeatedly to hear updates on our work. I would say that the policies that hold us back most are at the state level. So around issues around energy choice, having local control of our energy supply, being able to invest in renewable energy independently, as well as the issues around net metering, which affects the return on investment for people to put solar on their homes. It's really the state level policies that are holding us back.
Okay, and so I will, or someone will follow up with you for like your top two with a suggestion, and because some of us have some connections that might be helpful on that.
Wonderful.
And so huge thanks and to you for sharing your time, your team members. The work you're doing is life-saving and life-changing, and we likely will have you back again. So thank you so much.
Thank you. We look forward to it.
Okay. All right. Any questions or anything as we move on? All right. Looking at everybody. Just a few additions to the chair's update that you received. As I mentioned, beginning with the March 2022, we'll be meeting in person at the U of L Clinical Translational Research Building at 505 South Hancock Street. I wanted to do another shout out to Dean Blakely for his wonderful suggestion of the space and securing of the space, and ample street parking in the neighborhood of a few blocks from the public health building, large classroom, and we'll see how WebEx does there. As I mentioned in my update, Andy Slavitt, the former acting CMS administrator and now COVID advisor in the Biden administration, had a wonderful podcast in the bubble that explored digital vaccination records apps. And these apps, smart cards, that are based on a QR code are underway in several states. I had mentioned to listen in or to that podcast of Andy's. There's also a website for the network that gives lots of information. It's V for vaccination, vci.org. Dr. Moyer and I had a call yesterday with the Kentucky Immunization Registry, and to at least my delight, I'm sure Dr. Moyer's, Kentucky is going to join the Smart Card Network. They've already made contact with the vendor to use a QR code in Kentucky, so that in addition, if you're like me, you carry a paper copy in your wallet, you have it on your phone, etc., but to have the use of a digital code would be outstanding. It would be housed in the immunization registry, and so we've asked representatives from the registry to share the update at our December 1 meeting. So as someone at 9 o'clock on MSNBC says, watch this space. And finally, as the race for mayor develops in the coming months, I encourage each of you to join with me in learning about the candidates' perspectives on issues related to public health. It's critical to the future of health in our community, as well as our public health advocacy, especially as we emerge from pandemic recovery into what the chair calls new normal. With that, I'm going to turn it over to, so let me stop. Are there questions? Dr. Moyer's report was contained in the pre-board materials, so she's not going to go through that, but instead will share her insights from this month's activities as well as priorities over the next 45 days and any requests of us. Dr. Moyer.
Thank you, Chair, and morning, everyone. So yeah, please take the time to read that Board of Health report. The team, as always, doing really amazing work, and so just would appreciate it if you take the time to read that. Highlights from this last month that maybe not really in there. We did have our yearly annual meeting, which was we got great reviews from it. Always my favorite part is staff gets to ask all the questions that they've been thinking of anonymously, and so got some great insights into how people are feeling and thinking, and just appreciated their honesty with that. And then my senior director's team's willingness and honesty to answer those questions. With that, kind of for the next month, we're doing a deeper dive into our interim bridge strategic plan that's focusing on our people, our workforce, and our buildings, really specifically trying to change systems to prevent more burnout with our staff, as well as ramping up proposals for our electronic health record and building repairs, as Heidi mentioned earlier. And then as well as really trying to figure out and refocus on what we do well, what we're needed for in the community, and then what maybe other partners can take over, and what's changed with Medicaid being expanded, and maybe what the health department doesn't need to continue doing. As well, the smoking ordinance citywide that was amended back in 2020 goes into effect January 1st. So right now, we went live yesterday. Any tobacco retailer can now register on the Excella website. We are sending out information to all places we know of, so mostly like restaurants and places that sell alcohol. But we know that there'll be places that we don't know of, and so if you guys drive by a vape shop or a tobacco retailer, please just make sure that they know as well that they also need to register for that. I'm excited about that. It'll help us identify where tobacco places are in the community, and target education resources, and just really see what the density is. Other priorities for the month, still working on ARP funding. We'll be going to council this week, and hopefully November 11th, they will approve some more funding for COVID for the rest of the year. We're asking for another $12.5 million for the rest of this fiscal year, and 15 for next year. And so we'll be working on same thing as for the rest of the department, just making sure that we're not doing anything that another partner can do well, and focus on the gaps where public health needs to step in as we cut back our response to COVID. Numbers are trending down slowly. We hit the orange for the first time in a long time. So that's a good feeling. I'm hoping it stays that way. JCPS still has their mask policy in place, are starting their test to play program. So hopefully this winter won't see as big of surges as last year, but we will we'll be watching it and ready in case it does. So I'm going to stop there. Any questions for me or my team? I know a lot of them are on right now. Happy to answer.
First of all, to the team, just the work that each of you and your fellow team members are doing is phenomenal. And Dr. Moyer was right about the board members reading the report, because the metrics are there that show the impact that you're having, not to mention the emotional and clinical impact that you're having. And an incredible shout out. This has been, I said to someone, it felt like decades. And to be sort of in the ring, so to speak, and to have 24/7 pressure really speaks to your abilities, your commitment, and your passion. And just know that the board is very grateful for that, as are the people who are touched by your expertise. Questions from the board? Comments? Dr. Moyer, thank you. let's move to advisory board members updates. And Dr. Stone, Eva, I see you in the box.
Good morning.
Here you are. The woman with probably the hardest job in the JCPS system, so go for it.
All thanks COVID. So I think you had wanted us to talk a little bit about just some of the major health issues that we're seeing in students, just seeing within the district. And so first and foremost is COVID. I mean, that's the bulk of the work that is taking place. It is a heavy lift for the schools for sure, but they're doing a good job. We have not had any major outbreaks so far. We've had a couple of instances that there's been several cases in a school. 9 times out of 10 when that happens, it's because somebody hasn't implemented the mitigation strategies the way that they need to, which Dr. Moyer mentioned. Our board and superintendent really has been proactive in making sure that we've got the mitigation strategies in place. And so I'm very thankful for that. I don't know how we would be doing school if we weren't trying to make sure these strategies are followed. It's just as concerning when schools inappropriately quarantine students. That may sound odd, but some of the schools were tending to quarantine too many kids without knowing for sure that they had been close contacts. And that ends up with students missing out on in-person learning, which is critically important for them, particularly with the learning loss and just the events of last year, the missed school. The other thing is, kids eat at school. Kids are looked at by other adults at school. And so there's all these social reasons that it's also critically important for our kids to be at school. So we really try and work with the schools when we see them quarantining large numbers of students, because again, that means somebody's not implementing something the way they should. And so that's been a big lift for our nurse practitioners and my team here, but they've really been doing a phenomenal job. One thing just to let you know that I think is of concern in the state as a whole, and that is our Medicaid program for the state has chosen to not allow school districts are able to bill Medicaid. They've chosen to not to allow districts to bill for COVID related activities such as contact tracing, COVID testing, and vaccine administration. And so that is a big deal for school districts, because I can tell you that's 90% of the work that our nurses are doing at this time. So the federal Medicaid program allows for this billing, but for whatever reason, Kentucky has chosen to not allow school districts to participate. So that's of concern. The other thing that is of importance and significance, I think, particularly for this group, are what we've seen as far as the pandemic and access to the healthcare system. You all have heard me say since I started attending these meetings that we have lots of evidence of kids not having regular access to healthcare, and the pandemic has certainly exacerbated that lack of access. To give you an example, last year, when everybody was out of school for the pandemic, we had almost 52% of our kindergartners had a preventive health exam. So just about half. Typically that's 85% to 88% of children in the district have that exam. And only 10% of our 6th graders had a preventive health exam. And then thus far this school year, we have 42% of our kindergartners and 12% of 6th graders have had that preventive health exam. So when they're not accessing the healthcare system, there are all sorts of opportunities we're missing to make sure that they're ready to learn, but also to make sure they're connected with that medical home and to have regular medical care. So those are really the big things that we're trying to work on, processes to address. And we'll be doing we've got some vaccine clinics scheduled. Last week, we did a clinic at Seneca High School. On Monday of next week, we've got 6 more high schools scheduled. We've tried to prioritize those schools by the amount of kids that historically have not had, they're behind on all the other vaccines. So we know that right now our focus is on COVID, but we're working on getting some systems in place to make sure that they have access to all vaccines, which again, that is I know, you've got your immunization committee. This is something that we've been trying to address in the city for some time, but I'm concerned that it's definitely worsened since the pandemic, something we'll have to have on our radar. And Angela's on here, I think. I don't know if she has anything to add. She is in the process of working with one of our other nurse practitioners to schedule. We're going to start administering vaccines on a regular basis at our Newcomer Academy, ESL Newcomer, which is by far and away the place where we have most concerns with children who are unvaccinated. So Angela's done some great work in getting us ready to do that. And so I don't know if she has anything she wants to add or not. Don't mean to put you on the spot, Angela. I know she had a situation at a school she was trying to deal with this morning, so she may not be on any longer.
In the interim, if you will get me some information on the Medicaid issue, I'll take it to my contacts.
I'll be glad to.
No magic wand or anything, so.
We need one, don't we?
Yeah, we more than. We probably need a hat and some rabbits. Okay, questions from the board for Dr. Stone?
But just to follow up on Heidi's comment, I'm surprised by the state's position on Medicaid for testing and services in the school related to COVID, given the governor's commitments around COVID and his desire to modernize the state Medicaid program. Do you have any sense about what's behind that?
I'm really baffled, quite honestly. CMS sent out their memos about the ability of school districts to bill for these services a couple of months ago. And thus far, the state hasn't been willing to look at those or to even discuss why they've taken the stance that they have about schools billing for these services. And I mean, I can just tell you, COVID is a lot of work. You all know that, right? This is very consuming for work for the schools, and I'm proud of the work that we've done with the health department. We had a grant from the Rockefeller Foundation, and we've been engaged in testing all through last year at the learning hubs, and then have been able to expand that and grow on it. And we've got some really robust testing processes in place, which I think is part of the big reason that we're able to be where we are. Our nurses do symptomatic testing for COVID. They're on site. We've got drive-through testing sites that are open. We've got 54 sites open across the district at this point in the evenings for parents and staff and family members. We've got 6 mobile buses that are going to our higher need areas where they may have some access issues. And then we've got in-school testing that happens once a week at every building, asymptomatic screening testing. And so there's a huge volume of testing that's happening. And again, that's been that partnership. And so, yeah, our nurses are engaged in doing that. So I'm really at a loss as to why Kentucky has taken the stance. I can't imagine that the governor is aware of this. One of the things is you can't bill for someone who is 100% federally, or who is federally funded, typically 100%, but that's still, even if we weren't billing for every person across the state, there are a lot of people who aren't funded federally that could be billing for these services. And it doesn't cost the state anything. The school districts pay the federal match, and the rest is federal dollars. So I'm not sure why we wouldn't be leveraging that for school districts, not just here, but across the state.
Right.
I guess I should say too, we started Test to Stay 2 weeks ago, which is kids who are close contacts. can do daily testing and be able to attend in-person learning. So far, that's going well. The biggest lift with that has been just making sure people understand the process, particularly internally, that the nurses are following the right protocols. And then Test to Play started yesterday. That's huge. That's been, if there's been any pushback on anything, it's been Test to Play, but that's everybody who's in extracurricular activities needs to test once a week, to have screening testing once a week. And so those are the things that are going to help us keep kids in person. And so lots of work, but lots of good things happening, I think, in Louisville.
Thank you. Dr. Breonna Pryor, Greater Louisville Medical Society. There you are. Update.
Good morning, everyone. So like everybody else, a lot of our activity in GLMS has been about COVID. And for those of you who didn't know some of the things that we did during COVID, when the pandemic first started, Bert, our executive director, he organized prescription deliveries. So folks who couldn't get out because they were in isolation or quarantine, he organized some physician volunteers to deliver medicines to those folks who couldn't venture out. So that's how a lot of our work with COVID started. It was just looking to see where the need was. We had a PPE drive for independent physicians who didn't have access to a lot of PPE, so we made sure that got delivered. And then as vaccinations rolled out, we did a lot of education. We did a few PSAs, both in English and Spanish, to get that information out there, and a lot of information sharing more on the physician side to make sure that our physicians across Louisville just were aware of what the changes are, because we all know that everything changes with COVID pretty rapidly. So trying to make sure we got all of that information out. But as Heidi said, we also have a new normal. So we want to think about what is going to happen after COVID. And there are other things that are happening outside of COVID that we still needed to address. So one of the big things lately is getting information out to our physicians about the Cures Act. And I'm not sure if you all are aware what the Cures Act is, but it's a federal act that requires that healthcare entities and physicians included have to provide immediate information to patients about their medical record. So it's an information blocking act, basically preventing that. So trying to make sure that our physician members are aware of that, because there's fines that are involved if they aren't equipped, and it's usually through an electronic medical record portal. So many of you may have Epic and you'll have MyChart. So that is one way that we can get information out to patients. But really what it is that patients need to have access to their record immediately. So making sure that we don't do anything to keep that from happening. So one of our goals for GLMS is making sure we provide that education to our physicians, because on the physician side, there are implications involved with that. And so we want to make sure that our physicians are aware and can prepare for that. And then other things is working with our just doing some things that can help our members. So Dr. Sosnin, who's our current president, his main goal for his presidency was physician wellness. So like everyone else, everybody's getting burnt out, particularly with COVID. Physicians are not immune to that. So really focusing on what things physicians can do to promote wellness, to prevent burnout. Our chair, Dr. Mona Lisa Taylor, has been working with the KHC Equity Advisory Committee, because again, with everything that happened last year with social injustice, she's really focused on that. And then in December, we're going to do our strategic planning, because we are going to think about a world past COVID and how GLMS can really partner with other organizations and really set us up for the future. And we haven't done that in a while. So more to come, especially after December, to talk about what our future for GLMS is. But I'll take any questions.
And thank you for everything the society is doing. Appreciate that, as well as your own work. And this is heroic work. Board, questions for Dr. Bao? Okay, moving along to Greater Louisville, Inc. and Shelby Williams.
Good morning, everyone. Happy to be here today. I will be brief. I'll start out. Our office is officially at 100% vaccination rate, which we're very excited about. So, we were happy to reach that goal, and we're still encouraging our members to do the same, and getting that message out there. For events, about a month ago, we did switch to a vaccination policy for our events. So we do require proof of vaccination for our events now, and we still do have a mask requirement. That'll probably stay for a while once, that sort of thing is in place. We don't want to take that away, and then if we go back to the red zone or something, have to put it back in place again. So probably until next year, we'll have those requirements. Most of us are back in the office now. It is still a little bit of hybrid work, but a lot of us are in here most days of the week, and especially since we did reach 100% vaccination, people are feeling more comfortable and coming in more often. Our legislative agendas are probably the biggest thing that we're working on right now. Our state and local agenda has been approved by our Public Policy Council and will be approved by our Board of Directors at our November meeting, and then will be unveiled at our final Capital Connection event of the year in December. I know we were talking about Brownfields earlier, and we do have in our local and state agenda support for Brownfield remediation. So I was talking to Heidi, and once we have that approved in public, we'll be sure to send that to you all before probably the January meeting. And then I'm happy to take any questions on any of that as well. Also just kind of trying to work at the state and local level to figure out, as I'm sure a lot of you know, there's a healthcare worker shortage right now, what we can do in the immediate and in the future. I know that's multifaceted. There are many different reasons why there's a shortage there, but trying to figure out if there's immediate funding that could help for that, to retain people here in Kentucky, or if it's training programs, more nursing slots, what that might be. So any information or suggestions or, anything that might be helpful from you experts, that would be helpful if you want to reach out to me to see where we can help when it comes to policy or advocacy. So I think that's it right now. Thank you, Heidi, for letting me speak today.
Thank you. Any questions for Shelby Williams? Well, kudos to Sarah Davishire Wisdom and the GLI board for work with the business community that has really stood up and contributed and collaborated and provided in-kind resources. I appreciate that through our recovery efforts.
Thank you.
So, Dr. Eccles, Immunization Committee, just very brief update. There you are.
Good morning, everyone. The Immunization Committee is still focusing on goals that we've set a few months ago. One of our main priorities, as we've talked about, was just kind of improving education for providers and people in the community about the immunization registry for the state. So Heidi, with your news about Kentucky gearing up to enroll in a digital vaccination passport program, that's very interesting and something I'm sure in the coming months we will hopefully get some more information about and be able to participate in any facets that we can. Outside of that, with all of the it's kind of the height of vaccination season for a lot of us that work in the public. It's flu season. Of course, COVID. Sorry, I do have a little one in the background. I apologize. So just focusing on those goals that we set a few months ago and looking forward to kind of just making some impact with those initiatives. And I'd be happy to take any questions as well.
Questions for Dr. Eccles? And we will be in touch. Your nudging and that of Dr. Nota and others with the immunization registry, but more importantly with the physician community and clearly pharmacists now who are in the vaccination efforts as well. are terribly important because you have a special nudge that you can secure success with. So thank you. All right, Dr. Zippel. Oh, before we get to Dr. Zippel, Ashley Shoemaker is on jury duty and doing her civic responsibility and sent me a note. The Coverage and Outreach Coalition met recently and discussed outreach efforts from the state and state exchange group connector in hard-to-reach populations ahead of open enrollment. And as you may be aware, open enrollment for the state exchange for coverage opened November 1 yesterday. There are 2 new insurance companies being offered that join Anthem and CareSource in Jefferson County. One is Passport Health Plan by Molina Healthcare. The other is Ambetter from WellCare. It's the largest number of insurers or of insurer choice since Connect was dismantled in 2017. So open enrollment runs from now through January 15th. We'll see what the interim report is because the next meeting is scheduled for December 13th. So, and going back to something that Dr. Stone said with regard to Medicaid payment, it'll be interesting because the Medicaid people are part of this coalition. So we'll sort of bring those 2 ends together in solving that funding problem. So with that, now Dr. Zippel for whole health, and as I had mentioned, for our December meeting, we'll hear a little bit more in terms of some of the issues that Dr. Zippel and his committee have been involved in. Dr. Zippel.
So just one quick update. The little committee that I'm involved with has been talking about child behavioral health issues in the community, and it looks like that's the direction we're going to focus. I've invited Shannon Moody, who is the Chief of Strategic Initiatives at Kentucky Youth Advocates, to join us. Shannon and KYA have their fingers in lots of related things and will be a great asset, I think. I'm still looking for another board member who might be interested in hopping on, and as we begin to sharpen our focus on child mental health issues that may capture someone's interest. So if anybody would like to talk about that, tag me. We can swap emails, get together to talk by Zoom, and move ahead. Thanks.
Okay. Very good at voluntold. So I hope one of you takes Dr. Zippel up on his request. The good news is we have community engagement here, which allows us to cover new ground and to be able to hear from people who are involved day to day. I'm going to turn it to any board comments in general, issues in the community, issues that you've experienced in your practices, et cetera, et cetera. Floor is open to each of you. Okay. Is there any old business to come before us? Any new business? Okay. Well, I think one of the achievements from this meeting is some of us weathered WebEx, and maybe there's a vaccination, we can offer WebEx to allow that. I, again, apologize. Couple of announcements from me. Our next meeting, Wednesday, December 1st. Remember, we're returning first Wednesday of the month, 8 a.m., virtual, and it will focus on public safety. The perspective session speaker will be Dr. Susan Bacchino, who was appointed yesterday to head the Homeless Initiative Department and Services for the city. She's Assistant Director of the University of Louisville's Public Health Schools Commonwealth Institute and author of the Louisville Metro Alternative Responder Model Research and Planning paper that really speaks to alternative/deflection in policing and other public safety efforts. And so she will address that model. Look for a pre-read. We will send you the complete document, but there's an executive summary right up front, and she asks that each of you review that prior to the meeting. And given she's a professor, I don't know if she's going to test us, but regardless, it's a very comprehensive report. Any other announcements from the group? Well, again, a shout out to each of you in your efforts, and a shout out to the public health team, and huge wishes for a very happy new normal Thanksgiving. It's hard to believe, and that it's Thanksgiving time, although the weather seems to portend turkey time. So with that, the chair will entertain a motion to adjourn if there's no other business. See a motion, second. Thank you. Any opposed? The meeting stands adjourned, again, with sincere apologies, and best wishes to you for a happy Thanksgiving, and thank you for everything you do daily. And as I like to say, more later.